Swadikap and good afternoon once again. Today is Monday, the 22nd of March, 2021, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA. And we're here for you every Monday, Wednesday, and Friday. So first of all, thank you to Dr. Apisamai or Dr. Bird for the Thai language summary. She mentioned one thing about the pandemic fatigue, which actually is something that we all are experiencing around the world, not only in Thailand. But of course, to address this, next month we'll be having Songkran festivities, very important for Thailand, for those who live in Thailand or are familiar with Thailand, a very important occasion. Of course, Songkran can be celebrated, but as announced in terms of the traditional way of celebrating it, pouring water on the hands, on the palms of the elderly, the religious festivals and the like, but no water splashing. It's just as a precaution. And Dr. Apisamai also mentioned about the new cluster in Samut Prakan province, which she mentioned about the index case or the first case in Samut Prakan province, which actually started in a construction site. And I'll go to that in a short while. But first of all, the daily numbers that we have for today, and we'll have a chart coming up for you. Today we have new confirmed case, 73 cases, out of which 7 are from those traveling back from abroad, and the remainder were found within the country. From those within the country, out of that number, 44 are from active case finding, and the rest from local transmission. You can see on the screen right now, the most important box is the one in green, active cases still being treated in Thailand, numbering 1,122. We have one new fatality, sadly, to announce to you today, making the cumulative number of fatalities 91. The 91st fatality is a 60-year-old Thai male with pre-existing ailments, conditions of diabetes, high blood pressure, as well as lung cancer. Just some observations from the Thai language edition of the summary. The tally in terms of the provinces actually have been kind of consistent and kind of stable. However, there were some provinces which found their first or few first cases of COVID. So for example, Yasothon province yesterday recorded the first case of COVID, making Yasothon not being COVID-free anymore. So that one case of COVID in Yasothon was actually from the cluster in Samut Sakhon, someone traveling back from Samut Sakhon to Yasothon. Other provinces such as Mukdahan and Srisaket province had their first few cases, and Mukdahan and Srisaket had their first cases actually as a result of the cluster from Bangkhae. So of course, Bangkhae district in Bangkok. So of course, the interprovincial travel played an important role in this spread to some provinces which previously did not have any cases or had a few cases. This actually is good news because we were able to track from the first case in each province. So for example, in Yasothon, there was the first case. This was the result of the hard work of the village health volunteers who actually monitored the entry of certain individuals into the province of Yasothon when after he or she had traveled back from other provinces, in this case being Samut Sakhon. So the village health volunteer monitored this entry, reported this entry, and received the good cooperation from the patient and from the people in the area. That's why we have Yasothon recorded. So it's actually good news that we're aware and we're able to control this first case in that province. Also, right now, as the numbers show, there are now 11 provinces that remain COVID-free with no COVID at all since the very beginning, 11. Right now, we have around, in terms of vaccination, just like to report to you that we have already vaccinated in Samut Sakhon province in particular over 35,000 vaccinations already using AstraZeneca. Now, the second dose of vaccination in Samut Sakhon will start today. So this is actually a step in a very positive direction that we are successfully administering the second inoculation of vaccines in Samut Sakhon, over 35,000 already. And as you know, Samut Sakhon had been the epicenter of this new wave. Now, just to update on the COVID situation elsewhere, particularly in Samut Prakan province that I mentioned, the cluster there. So over the weekend, the new cluster of confirmed cases was detected in Samut Prakan province, which were found to be linked to a construction camp. Now, the initial carrier was a migrant worker who was tested during the process of obtaining the work permit. The Department of Disease Control then conducted active case findings for over 1,000 people in the construction camp on Sukhumvit Soy 117, which is actually in Samut Prakan province, and as well as the surrounding areas. So active case finding was immediately conducted in that area, which resulted in finding 16 more positive cases. Now, moreover, the results from 400 people being tested through active case finding are still being confirmed. So the Ministry of Public Health will continue to operate these active case finding missions in high-risk areas in Samut Prakan. The construction companies in the area were also urged to improve the conditions of the workers, the health conditions of the workers, the setup of their dormitories, for example, as they tend to live in somewhat overcrowded facilities or accommodation, which would possibly increase the risk of infection. Now, the Ministry of Public Health has also continued to conduct testing in Bang Khae district in Bangkok. That still continues. Active case finding in Bang Khae in the western part of Bangkok. Now, in total, over 15,000 people have been tested in terms of active case finding, which resulted in a total of 384 positive cases in cumulative couple of days. Now, that was a question posed on social media, which I've answered on air here. So over 15,000 people have been tested, particularly in Bang Khae, which makes actually approximately 4,000 active case finding on average per day in that area. And the Bangkok Metropolitan Administration has also inoculated more than 3,000 vendors and workers in various fresh markets. If you recall, the fresh market cluster in Samut Sakhon. Now, this is for Bangkok now. The 3,000 vendors and workers, and they are going to open a second field hospital near the Tawi Watana district to increase the efficiency and, of course, for the increased facilities for inoculation in Bangkok. So this is from the Bangkok Metropolitan Administration. Just some additional information on quarantine, area quarantine scheme. So as announced earlier, from the 1st of April 2021, we will be operating the area hotel quarantine scheme for international travelers. This information would be relevant to international travelers coming into Thailand. The hotels that are allowed to participate in this area hotel scheme now include those located in Pattaya, Chiang Mai province, and the provinces of Krabi, Phuket, Surat Thani, which include Got Samui, Got Tau, and Got Phangan. So international visitors coming into this area hotel quarantine will be required to stay in their hotel room for the first 3 days and will then be tested for COVID-19. If negative, they'll be allowed to leave their room and use the facilities around the hotel or resort for the remainder of their 14-day quarantine. At the end of the 14-day period, they will once again be tested, and if negative, allow to freely travel around. If you recall, on Friday we had the general CCSA meeting where they announced for the general reduction of the 14-day quarantine time span to go down to 10 days starting the 1st of April 2021 from those coming from countries which do not have the variant strain. Now, more details of that list. Some of the audience was asking online where to acquire that list. That's still being ironed out and will be announced soon on which countries are included in the variant strain list for Thailand and those countries that are not included. So Dr. Pisamai also mentioned about the arrival of vaccines. This past Saturday, on the 20th of March, was this past Saturday, we had received 800,000 more vaccines from Sinovac and the new shipment. The new shipment of this vaccine was transported to the Department of Medical Sciences for its routine quality testing and will soon be distributed to 18 provinces nationwide. As you heard me summarize, these inoculations are according to plan and in various provinces around the country, particularly in the important provinces that were the epicenter. For example, Samut Sakhon, I mentioned, over 35,000 have already been inoculated. So the government has decided to, of this number, 800,000 new arrival, the government has decided to allocate 300,000 out of the 800,000 new vaccines to provinces considered major tourist destinations as well, major tourist destinations. The remaining vaccines will be distributed to provinces along border areas and to provinces with high infection areas, aside from the priority groups that we all know now, the emergency group, emergency use, medical staff, those in the front lines, and the like. So just in closing, I'd just like to mention that on Saturday, last Saturday, the 20th of March, was the National Village Health Volunteers Day. So in the beginning of this presentation, I mentioned, and Dr. Pisamai also mentioned, the important role of the village health volunteers in detecting and reporting the various cases, including the first case in Yasothon province. So therefore, I'd like to take this opportunity to express once again the appreciation for the tireless work of the village health volunteers in Thailand, known in Thai as Osmo, especially on their role in helping and preventing communities nationwide to prevent COVID-19. And these volunteers have been a key part in the primary health care in Thailand during the past 4 decades and have been praised by the World Health Organization as the unsung heroes of the Thai healthcare system. So there are more than 1 million active volunteers who undertake health surveys, collect data, and do disease prevention campaigns to support public health authorities in times of outbreaks. Their meticulous record of the medical history of the community members are used in contact tracing and in health monitoring. And just to note that aside from the Thai nationals who are village health volunteers, there are also village health volunteers who are from the nationalities of our neighboring countries. So from Cambodia, Lao PDR, and Myanmar people in Thailand volunteering as village health volunteers and translating and communicating when they go on site visits in various areas around the country and communicating with people who speak those languages or are nationalities of those countries which are neighboring countries of Thailand. So this is what I have for you today. Thank you for your attention. We'll see you again on Wednesday. Please stay safe and take care. Have a pleasant week ahead. Thank you. สวัสดีครับ
ครับขอบพระคุณนะครับท่านณัฐภานุ นพกุลนะครับรองอธิบดีกรมสารนิเทศและรองโฆษกกระทรวงการต่างประเทศนะครับสำหรับการแถลงข่าวสื่อสารในส่วนของภาคภาษาอังกฤษนะครับ